Many employers count on drug testing to screen workers, and drug counselors rely on it to screen clients. But some say a growing market of over-the-counter products makes it easier to cheat. 11 News I-Team reporter Barry Sims investigates.
We sent an 11 News intern into a store to buy something that could help cheat a drug test. He spent $20 and came out with this, Extreme. It's one of many synthetic urine products on the market. The manufacturer calls it a novelty item, not intended for unlawful use, and claims it has the same characteristics as real human urine.
It should be a concern for anybody that has to be tested for urine.
Israel Kaysan is the president and founder of I Can't, We Can, a drug recovery center in Baltimore's Park Heights community. He's heard a lot about Extreme.
It's a temporary fix.
He calls synthetic urine a way of cheating that can catch up with drug abusers.
If it looks like urine and it tests like urine, it goes right through the laboratory without them even detecting that there's been a problem.
Ted Schultz is the director of the American Association of Medical Review Officers. The organization established a mandatory certification program for drug testing.
The goal was to deter people from doing it. You know, the whole idea of drug testing is yeah, it's nice to catch people, but you really don't want to catch them. You really want them to change their behavior before they get hooked.
He says products like the synthetic urine our intern found pose problems for drug testing labs. This lab at Johns Hopkins Hospital tests mostly for medical issues, but Dr. William Clark says the lab is aware of what he calls an emerging problem.
It is a concern in our lab, as we, especially, in a very focused way for our pain management patients, we're developing ways for us to identify people that add things to the urine to try to hide or mask drugs that may be in there.
The I-Team discovered Maryland does have a synthetic urine law. It makes it illegal to possess, sell, or distribute synthetic urine with the intent to defraud or alter the outcome of a drug or alcohol screening test. State Delegate Kurt Anderson co-sponsored it.
There's only one reason why you would want to have synthetic urine, and that is to use it in situations where you know you cannot use your own.
A worker at the store where we purchased Extreme told us it's sold for sexual fetish only. If a buyer states intentions to use it for other or illegal purposes, they can't sell it. At Hopkins and other labs, the challenge is staying a step ahead.
Part of the problem is as soon as you develop one system or a set of checks and balances to check for these specimens, oftentimes there's a new product or a new method on the market that becomes available that people use to hide their drug use.
Andy says continually trying to develop other ways to detect fake urine could substantially increase the cost of testing and health care.
The only antidote to this problem is changing the lifestyles.
Kaysan continues working on that with his clients, but still worries about what we found, how easy it is to get products that could help them cheat. For the 11 News I-Team, I'm Barry Sims.